Welcome to the U.S. Army Recruiting Command and to the Tricare Options for Active Duty and their Family Members briefing. This presentation will provide an overview of Tricare coverage available to active duty service members and their eligible family members living in remote locations. For the purpose of this brief, active duty service members will be referred to as service members, and active duty family members will be referred to as family members. All service members in USAREC are considered active duty. Today we will discuss what Tricare is, how to determine and establish your eligibility, and what medical coverage is available to you. We will also cover Tricare benefit information, including pharmacy options and dental programs, and other important information. Finally, we will provide you with important resources so that you can get assistance and find answers to any additional questions you may have. To learn more about your Tricare options, visit www.tricare.mil. First, we will discuss what Tricare is. Tricare is the Uniform Service Healthcare Program, which brings together the healthcare resources of the military health system, such as military hospitals and clinics, with Tricare authorized civilian healthcare professionals, institutions, pharmacies, and suppliers, both network and non-network, for beneficiaries eligible by law. Please know that we have Soldier and Family Assistance Program Managers at each battalion and brigade. They are all Beneficiary Counselor Assistance Coordinators, or BCACs, and can assist with all things Tricare. To contact your SFA, utilize the 800 number located on the screen. This number will put you into contact with any SFA. Just know which brigade and battalion you belong to. Tricare is available worldwide and managed regionally. There are two Tricare regions in the United States, Tricare East and Tricare West, and one overseas region with 3 areas, Tricare Eurasia Africa, Tricare Latin America and Canada, and Tricare Pacific. Benefits are the same regardless of where you live, but there are different customer service contacts for each region. HealthNet Federal Services LLC administers the benefit in the West region, and Humana Military administers the benefit in the East region. Both regional contractors partner with Military Health System to provide health, medical, and administrative support, including customer service, claims processing, and prior authorizations for certain healthcare services. Contact information for each region will be provided at the end of this presentation. The U.S. Family Health Plan is a Tricare Prime option available through separate healthcare systems in 6 areas of the United States. If you are in the U.S. FHP, you may not get care at a military hospital or clinic or use military pharmacies. Enrollment is required. Active duty service members are not eligible for this program. You will get care from a primary care provider in the healthcare system where you are enrolled. Your primary care provider will refer you for specialty care. If you disenroll from this program or move out of the service area, you will regain eligibility for other Tricare programs. To find out if you are in the U.S. FHP area or to enroll, visit www.usfhp.com. Military hospitals and clinics provide medical and dental care. However, when it comes to civilian providers, they must be authorized by Tricare and certified by the regional contractors to give you care. There are 2 types of Tricare authorized providers, network and non-network. Network providers have agreed to accept the Tricare allowable amount as the full payment for any healthcare coverage you get and agrees to file claims for you. You can save money by seeing network providers. Non-network providers do not have an agreement with Tricare, and you may have to file your own claims. There are 2 types of non-network providers, participating and non-participating. Participating providers accepts the Tricare allowable amount as the full payment for any covered service that you get and files claims for you on a case-by-case basis. Non-participating providers do not accept Tricare allowable amounts as full payment for covered services, nor do they file claims for you. They may charge up to 15% above the Tricare allowable charge. If you see a provider that is not Tricare authorized, you will pay the full cost of your care. The Defense Enrollment Eligibility Reporting System, or DEERS, is a database for service members and dependents worldwide who are eligible for military benefits, including Tricare. You can register in DEERS through the MilConnect website listed on the screen. MilConnect is the Defense Manpower Data Center's online portal that gives you access to your DEERS information. You can also update your information by phone, fax, or by visiting the Uniformed Services Identification, or ID, card issuing facility. To make changes to your family composition, proper documentation such as marriage certificate, divorce decree, birth certificate, and/or adoption papers is required. Please note, only the sponsor can change a family member. Family members age 18 and older may update their own contact information. Remember, healthcare providers are legally permitted to copy your military or dependent IDs to verify your Tricare eligibility. Now, let's discuss Tricare program coverage. Tricare Prime and Tricare Prime Remote work in a very similar way. Tricare Prime Remote is available to active duty service members living and working in remote locations. Tricare Prime Remote for active duty family members is available to eligible family members who live at the Tricare Prime Remote enrolled sponsor's address. Enrollment is required for both the service member and family members. These programs offer the same low to no out-of-pocket costs as Tricare Prime, and beneficiaries receive care from Tricare network providers or Tricare authorized providers if the network provider is unavailable. Contact your regional contractor to determine what providers are available to you. Let's look at what makes someone eligible for Tricare Prime Remote. Service members who live or work more than 50 miles or approximately a 1-hour drive from a military hospital or clinic in the Prime Remote designated zip code must enroll in Tricare Prime Remote. Keep in mind that there may be situations where you and your family members are within 50 miles, however, the drive is over an hour. There is a waiver that can be completed, asking for exception. Please contact your SFA for more information or go to the website listed at the bottom of the screen. Family members who live at the Prime Remote enrolled sponsor's address are also eligible for Prime Remote. Once you enroll, you may remain in the plan as long as your sponsor is enrolled and you live at the same address with the sponsor. If you choose not to enroll in Tricare Prime Remote, you can enroll in Tricare Select. Eligible beneficiaries who wish to enroll in Tricare Prime must complete and submit a DD Form 2876. Enrollment applications may be downloaded from www.tricare.mil/forms. Enrollment in Tricare Prime is effective on the date the regional contractor receives the enrollment application. Enrollment in Prime Remote is optional for family members. However, family members must enroll within 90 days of their move to the Prime Remote location or during Tricare open season. Family members who elect not to enroll in Prime Remote can enroll in Tricare Select. There are no annual enrollment fees for service members or their family members enrolled in Prime Remote. Prime Remote enrollees will receive most care from their primary care manager, or PCM. PCMs provide preventative services, care for routine illnesses or injuries, coordinate access to urgent care, and manage referrals to specialists or hospitals if needed. If more than one network PCM is available, you may choose the PCM you prefer. Beneficiaries who live in areas without Tricare network providers may be assigned a Tricare authorized provider for primary care. Beneficiaries may contact their regional contractors to locate Tricare authorized providers or visit www.tricare.mil/find-a-provider. Tricare Young Adult is a premium-based healthcare plan available for purchase by qualified young adult dependents who have aged out of Tricare. You may buy Tricare Young Adult coverage if you are all of the following: a dependent of an eligible sponsor, unmarried, at least age 21 but not yet 26, not eligible to buy health care through your employment, not otherwise eligible for Tricare program coverage, not a service member yourself, including a member of the selected reserve. Tricare Young Adult includes medical and pharmacy benefits, but does not include dental coverage. It offers Tricare Prime and Tricare Select coverage worldwide. Your sponsor status and your location determine which plan you may buy. You must enroll and pay monthly premiums. You have the same provider choice and costs as those with Tricare Prime or Tricare Select. Routine care includes general office visits for the treatment of symptoms, chronic or acute illnesses and diseases, and follow-up care for an ongoing medical condition. Routine care also includes preventative care services to help keep you healthy. You will receive most of your routine or primary care from your PCM. There are times when specialty care is needed. When this occurs, your PCM will coordinate your care with a regional contractor. For service members, any urgent specialty care referrals, meaning less than 48 hours from the time of your PCM's initial office visit, will be sent to the regional contractor for review and approval. If you need additional specialty care, the regional contractor will refer the request to the Defense Health Agency, Great Lakes. The DHA Great Lakes review all requests and assesses if the service member needs a fitness for duty determination. Service members with questions may call the DHA Great Lakes at 1-888-647-6676. Specialty care referrals for family members are managed by the regional contractors, not DHA Great Lakes. Beneficiaries who do not have a network PCM will need to coordinate their own specialty care with their regional contractors. When family members are referred for specialty care more than 100 miles from your PCM's office, you may be eligible for travel reimbursement. The point of service option gives family member enrollees the freedom at an additional cost to receive non-emergency health care services from any Tricare authorized provider without requesting a referral. Please note that you may pay out of pocket when using this option. Service members are not allowed to use the point of service option. With this option, you will be responsible for the initial deductible and then cost shares after the deductible is met. Tricare defines an emergency as a serious medical condition that the average person would consider to be threat to life, limb, sight, or safety. If you have an emergency, please call 911 or go to your nearest emergency room. You do not need to call your PCM or the regional contractor before receiving emergency medical care. However, in all emergencies, your PCM must be notified within 24 hours or on the next business day following admission to coordinate ongoing care and to ensure you receive proper authorization. Urgent care services are medically necessary services required for an illness or injury that would not result in further disability or death, if not treated immediately, but that require professional attention within 24 hours. You could receive urgent care for conditions such as a sprain, sore throat, or rising temperature, as each of these has the potential to develop into an emergency if treatment is delayed longer than 24 hours. Family members can get urgent care without a referral. If you are a service member enrolled in Prime Remote, you can also receive urgent care without a referral. However, the Department of Defense and your military service requirements regarding getting care from outside of the military hospital or clinic still apply. So it is best to contact the Nurse Advice Line at 1-800-874-2273 for a referral. To avoid paying point-of-service charges, you should seek care from a Tricare Authorized network or non-network urgent care center. Now let's move to Tricare Select. Tricare Select is a self-managed preferred provider option for eligible beneficiaries that are not enrolled in Tricare Prime or Tricare Prime Remote. Tricare Select allows beneficiaries to choose their own Tricare authorized provider and manage their own health care. Service members cannot enroll in Tricare Select. With Tricare Select, you must be registered and show as eligible for Tricare Select in DEERS. Enrollment is required to be covered under Tricare Select. With Tricare Select, you can see any Tricare authorized provider, both network and non-network. But you save money when you use Tricare network providers. Referrals are not required for most healthcare services, but some services may require a prior authorization from your regional contractor. There is a yearly deductible for Tricare services, and you pay cost shares or copays for most services. You may have to pay for services up front and file your own claims for reimbursement. For more information, visit www.tricare.mil/select. Like Tricare Prime, your out-of-pocket cost will generally lower when you use Tricare network providers. A Tricare network provider is a provider that accepts the Tricare allowable amount as the full amount for any covered healthcare service you get. Tricare network providers also file claims for you. To find a network provider, go to www.health.mil/providers or contact your regional contractor. You may also contact your SFA for assistance. If you are seeing a non-network provider, ask if he or she accepts Tricare and is authorized to be paid by Tricare before receiving care. If not, invite that provider to become a Tricare authorized provider at any time. The provider simply needs to contact your Tricare regional contractor for more information. Beneficiaries who see non-network providers may have to file their own claims. If you are overseas, you may get care from any Tricare authorized provider or military hospital or clinic on a space available basis without a referral. This slide highlights Tricare Select outpatient deductibles. The yearly deductible varies based on your beneficiary category and the type of coverage, individual or family. Groups are determined by when the service member began service. Group A is prior to January 1, 2018, and Group B is after January 1, 2018. Family members with sponsors in Group A and in pay grades E4 and below have a $50 individual deductible or a $100 family deductible. Family members with a sponsor in Group A and in pay grade E5 and above have a $150 individual deductible and a $300 family deductible. Family members with sponsors in Group B and pay grade E4 and below have a $52 individual deductible and a $104 family deductible. Family members with sponsors in Group B and in pay grades E5 and above have a $156 individual deductible and a $313 family deductible. Enrollment is required for Tricare Select coverage for family members. There are 3 ways to enroll. Enroll online through the beneficiary web enrollment website, where you can also update your DEERS information. You can call your regional contractor. Contact information is provided at the end of this presentation. Or you can download a form from the Tricare website or your regional contractor's website and mail the completed and signed form to your regional contractor. We will now discuss Tricare benefit information. Having a new baby or adopting a child? Pay attention to your benefits. You will need to register your child in DEARS. If you are stateside, you have up to 90 days to enroll, and overseas, you have up to 120 days. When you register in DEARS, your child will automatically be enrolled. If you are stateside and in a Prime service area, you will auto-enroll in Tricare Prime. If you are not in a Prime service area, you will auto-enroll in Select, where you will begin to accrue costs. If you are overseas, your child will auto-enroll in Tricare Select, and again, you will begin accruing costs. Please keep in mind that you can change your coverage, but you only have 90 days following the auto-enrollment to make changes. If your child is not registered in DEARS, your child will not show as Tricare eligible, and your claims will begin to be denied for a child 91 days old stateside and 121 days old overseas. Tricare mental health coverage and substance abuse disorder, or SUD, services are available to you and your family during times of acute or ongoing need. Tricare offers a variety of services for beneficiaries diagnosed with mental health and/or substance abuse disorders. Tricare covers care that is medically or psychologically necessary. Certain limitations may apply. Availability, referral, and prior authorization requirements may vary by Tricare type, location, and your Tricare program option. For more information, visit www.tricare.mil/mental health. There are two categories of services, outpatient and inpatient. Outpatient services are offered in an office or a non-office setting and provided by a mental health professional. Tricare covered outpatient services may include individual, family, or group psychotherapy, psychoanalysis, and psychological testing. Referrals and prior authorizations may be required for certain outpatient services. PCM referral and supervision may be required when seeing mental health counselors and is always required when seeing pastoral counselors. Referrals and prior authorization is required for all non-emergency inpatient mental health care services. Psychiatric emergencies do not require prior authorization, but authorization is required for continued stay. Tricare offers prescription drug coverage and many options for filling your prescriptions. Your options depend on the type of drug your provider prescribes. The Tricare Pharmacy benefit is administered by Express Scripts. To learn more, visit www.express-scripts.com/Tricare or call 1-877-363-1303. You have the same pharmacy coverage with any Tricare program option. If you have the U.S. Family Health Plan, you have separate pharmacy coverage. To fill a prescription, you need a prescription and a valid ID or common access card. This slide shows the options that may be available for filling your prescriptions. Military pharmacies are usually inside military hospitals or clinics. Call your local military pharmacy to check if your drug is available. You may also visit them at www.tricare.mil/military pharmacy. The Tricare Pharmacy home delivery option must be used for some drugs. You will pay one copayment for each 90-day supply. For more information on switching to home delivery, visit www.express-scripts.com/Tricare or call 1-877-363-1303. You may also fill prescriptions at Tricare Retail Network pharmacies without having to submit a claim. You will pay one copayment for each 30-day supply. To find a network retail pharmacy near you, visit www.tricare.mil /network pharmacy. And non-network pharmacies, you pay the full price for your drugs up front and file a claim to get a portion of your money returned. There are 2 Tricare Dental program options available. Your eligibility depends on your beneficiary category. The Active Duty Dental Plan provides civilian dental care to service members who are unable to receive required care from the military dentist. This plan is a Department of Defense dental program. The benefit is administered by United Concordia. It provides civilian dental care to service members who are either referred for care by a military dental clinic to the civilian dental community or have a duty location and resident more than 50 miles from a military dental clinic. Please note that the plan is only available in the United States and U.S. territories. The Tricare Dental Program is a voluntary, premium-based DoD dental program available to qualifying family members. The Tricare Dental Plan benefit is administered by United Concordia. Care is provided by participating dentists. You may also obtain services from non-participating dentists, which may result in higher costs. Visit these websites provided for more information. The next slide provides contact information that may be helpful to you and your family members for using your Tricare benefit. Here is the contact information for stateside and overseas regional contractors, as well as other important sources. Remember, your regional contractor is based on where you live. Always remember that your SFA is a Tricare BCAC and can assist you.